everybody. I'm Kier Spates, and welcome to another episode of Living Your Life. Today on Living Your Life, a podcast that is solely dedicated to bringing awareness to sickle cell and how it impacts the lives of many. And we'll talk to someone making a huge impact that positively affects the lives of patients around the globe. I am joined by my good friend who's always here, my co-host, Dr. Corey Hebert. Dr. Hebert, how you doing, man?
Man, I'm doing so well. I wish I could be as well as you because you look good in that suit, man. But look,
Hey, appreciate it,
don't make me come through there.
I know,
Put it on you.
man.
I'll put
Hey,
it on
man.
you. I'll put it on you.
Hey, Dr. Hebert, you know what, man? Sometimes when we think about sickle cell and other illnesses, we think about how they affect our family, our community, or even affect those in the United States. But sickle cell is not confined just to the United States. This illness has a global impact. So here to talk to us today about the impact of sickle cell in Europe is sickle cell patient and advocate Dianaba. Jenna, how you doing?
Hello, I'm good. Thank you. How are you?
Oh, I'm doing fine. Welcome to Living Your Life.
Thank you. It's my pleasure to be with you today.
Oh my gosh, you look great. How you feeling?
Thanks. I'm doing great. How are you?
I'm doing fine. Thank you so much for coming on. So, Jenna, you are actually a patient advocate and a former head of the largest advocacy group in south of France.
Yes, actually, yes. I am the former CEO of a national organization, the largest national organization when it comes to sickle cell disease in France.
Oh my gosh, that is great, Dr. Hebert, in France.
And look, the first thing is I wish I was in France, especially the south of France. That's the first thing. But a lot of people don't recognize that when you are talking about sickle cell, people think it's America. This is worldwide because the continent, Africa, we started everything. That's where the world started, and we went everywhere. So I just want to thank you for your work because I know it's much harder to do that kind of stuff in places where, it's not as well known, like in France.
That's right. Thank you very much. Thank you for your support.
So, Ms. Jenna, tell us this. How did you get started in advocacy? How did that come about? What was your mindset then to say, I'm going to start advocating for other people with sickle cell? Where did you get that idea?
That is a great question. Actually, before, just like anyone else, before starting advocating for others, I had to advocate for myself first. I actually live in a country where there are between 25 and 30,000 patients with sickle cell disease. So it's the first genetic disease in France and in the world, but people don't really know about this disease. So every time I had to go to the ER or to the hospital or to see a doctor in general, I had to struggle and to repeat everything. And sometimes I was not believed. So at some point, I decided to advocate for myself and then to join local organizations and then national organizations.
You know what? That sounds like what I have to deal with over here in America, Dr. Hebert. Struggling with the healthcare, with the doctors, all of those things. Like so, as you think about this, how was it from when you were younger and to become an adult, like the transition for your care for sickle cell? What was that like for you?
I can say that it was hell. Transitioning was hell. It
was hell.
Hell, yes, it was hell. I mean, it was the worst time of my life.
Dr. Hebert, you start to sound like America now.
Yes.
Yeah, exactly, right.
Yeah.
Actually, when I was a kid, it was fine in kids' hospital. And then when I was about 20, they opened a ward for patients with sickle cell disease in another hospital with healthcare professionals who were not really trained. So at this moment of my life, because I was becoming an adult and studying and struggling with sickle cell disease and everything, I realized the impact that the disease would have on my life, like during my whole life. So it's been complicated because I did not get the support that I needed at this moment.
Well, you know what's crazy about that is that you said something, you had to start advocating for yourself. Now, when you were a child, you don't really have to advocate for yourself because everybody's kind of touchy-feely about it. Oh, it's going to be okay. But when you become an adult, and that's the same thing that happens in America. Now, let me ask you a question. When you're in a sickle cell ward or with a bunch of folks that have that there, are they all brown people? Or some of them non-brown people? Like, is there thalassemia people around, or is it just sickle cell and just brown people like us?
No, actually, in the hospital, you have different disease, different chronic disease. It's not only about thalassemia or sickle cell disease, but when it comes to sickle cell disease, majority of the patients are black or brown. But nowadays, the population is changing, so you have a lot of light people with sickle cell disease.
Yeah.
Light people.
Light skin people. Sorry, my language.
They call it white people light skinned in France, but we just found out. This is breaking news. He said light skinned people.
Look, don't throw away your El DeBarge posters just yet.
No, that is different. That is very different. And I know, like for me, but my sickle cell story, Miss Jenna, was about all the things they told me I wasn't going to be able to do. I wasn't going to be able to play sports. I wasn't going to be able to do this. I wasn't going to live a very long time. All the things. So, what are some of the challenges that you faced that doctors told you that you proved them otherwise wrong? How did that work for you, Miss Jenna?
Well, I was not supposed to do sports when I was young, but my father decided that all of his kids would do sports. So we all did sports. Then we were not supposed to be very smart, very intelligent. So I'm very happy because now I have a master's degree. I speak 4 or 5 languages, and I've been able to live abroad in other countries and continents. So everything that they told me when I was young, I proved them wrong. So I'm very happy about that.
I am too. You speak 5 different languages?
Yeah.
And you played sports?
I used to do sports, now less, but I used to do sports when I was teenager and young adult.
Yeah.
But between me and Kier, we speak 2 languages, English and jive.
That's all it. But see, that had to make you feel good to say what they told you, what you couldn't do, and then you turn around and did it. Because I know how hard it is when they tell you that you can't do something, and all your friends are doing it, or all your classmates are doing it. Did that have an effect on you when you was in school as well?
Yes, I was not really allowed to go on trips with other kids because, and I can understand that the teachers were afraid something would happen to me while I would be with them. And no, I mean, I've always had the idea because doctors and some teachers told me that it would be very hard for me to study. And it's been hard. I have to be honest. It's been a lot of sacrifices, but at the end of the day, it was a priority for me and for my family who supported me. So I managed to do it, but it's been hard.
Yeah. And let me ask a question on a little different tip here. When you France kind of has what like socialized medicine, where medicine's kind of free. In America, it's very, very, very different. So who pays for all of the stuff that you've had to go through, the emergency room and all the admissions and the medicines? Who pays that? And is it a long wait to get this stuff?
Well, actually, yeah, the healthcare system in France is very different because all of the citizens, who work, pay taxes, and those taxes pay the public healthcare system. So when you have sickle cell disease or chronic disease in France, you don't pay for your medication. You have access to, let me put it that way, to a better healthcare system than in America.
Wow.
But still, you have strong inequalities when it comes to treating patients with cancer, for example, and treating patients with sickle cell disease.
Yeah, I understand that. Because, see, in America, we pay taxes too. Kier, I know I pay taxes. I know you pay taxes, but we still don't get free health care.
No, we don't. But explain to me, like, the difference between, in France, a sickle cell patient's treatment and a cancer patient's treatment, because I find it interesting. What do you mean there's a difference?
There's a difference because, for example, now we hear about sickle cell disease. It used to be, I'm talking about France, it used to be a Black people condition, African people condition. So the state would not really help out the organizations or the people. I'm not talking about the healthcare professionals who always, most of them, the specialists, did their job right. But the policy that has been made for cancer, like national plan and etc., it's never been done for sickle cell disease, and it's one of the disease that is having the highest raise when it comes to number of babies being born with sickle cell disease.
Now that's an interesting point, because so like your organization, so you're trying to say like like the government won't give money to support your organization, but they'll give money to support the cancer advocacy groups, which makes a big difference about outreach and knowledge. Because if you let somebody know that they have sickle cell trait,
Mm-hmm.
then it would decrease the morbidity and mortality. So they shoot themselves in the foot by not supporting you.
That's right. And one of the main issue was the newborn screening. Until November of last year, so less than 6 months, it was a targeted newborn screening. And now it's universal newborn screening, because we know that people with a trait can be brown, black, or white. It doesn't matter. So we need to focus on prevention.
Oh, absolutely, absolutely. And Miss Jenna, let me ask you this: is there? And I know how it is for me here. Like here in America, they think that if you touch me, you get sickle cell disease. Like the stigmas that go along. What are some of the stigmas that you have in France that we may not be aware of here in America?
I feel like in France, you don't have this type of stigma. You have it mostly in Africa. But in France, with patient education, people understand that it's genetic. But for some families, they would say that having a child with sickle cell disease would bring bad luck to the whole family. But this type of stigma, you don't really have
what? It. Is that in Africa?
Yeah, in some countries in Africa, yes.
If you have sickle cell disease, it brings bad luck to a family. Why is that? I'm the one got it. What? How is that? How is that a bad stigma? Oh, he got sickle cell. And man, that just goes to show you that it's very different here in America than it is in other countries. Because if a family feels like you have sickle cell in Africa and it's going to bring bad luck to the entire family.
Well, I mean, basically, they're saying it's like God cursed you for giving you a baby with sickle cell.
Yes.
Yeah. And that is with a lot of diseases in Africa. I find that's the case. I mean, in some places, it's even if God gives you a girl, then you're cursed in some places, which we don't feel that way in the United States.
That's right. But I mean, it's a really different context, because in the US, even if you don't have money, you can still get some help, even if it's not perfect. In France, still, everything is far from being perfect, but you have access to health care. In Africa, when you have a baby with sickle cell disease or any other chronic disease that's complicated, and you cannot afford buying Tylenol or any medication, it is complicated for the families.
Ah, man. Well,
also known as paracetamol.
Yes.
Yeah.
See, they don't know about that. I had to bring a little something out. They don't know about that in America.
Yeah, Dr. Hebert. I've never heard that word in my life. Paracetamol.
It's all good.
I can't tell you what that means. I don't know. No, I can't. But you know what, though? We appreciate you, Miss Jenna, because you're doing such a great job. So tell me, what advice can you give to a sickle cell patient when it comes to speaking up for themselves when faced with having to educate themselves with sickle cell disease? What's that advice do you have?
I think that the patient is a specialist of their own disease. This is a priority. Many times, I'm pretty sure it happened to you as well. Many times I felt bad and I knew something wrong was going on in my body. I went to the ER and the doctors would not believe me. They will tell me, no, it's nothing. You're going to be fine. You're just being stressed or whatever. So you know more than any healthcare professional about your disease. I'm not talking about sickle cell disease in general, but about your body. So speak up for yourself. And then I know it's very hard, especially for young people, to speak up for themselves. So the priority would be to make sure you have your family and friends around to support you when you need it. And I know that a lot of patients don't see the point for now, but patient organizations are ruled by patients. All the decisions are being made by patients or carers for patients. So if you are not able to talk to healthcare professionals or to your teacher in school or to anyone at your job, just reach out to a patient organization. They would help you.
Let me follow it up with one quick question. If you could wave a magic wand and change one thing about how your organization could do something, what would that be? If you could just say, I can do this, what would it be?
About our organization in France.
Yeah.
I think that we lack a lot of support to help the patients in their daily lives. And for that, we need the government to step up and to do something. So we need to change the law. It all works with the law. If we don't have politicians with us, we can do something, but not enough.
That's a magic wand that I wish we had over here, because it's all about politics and government. If we change the laws, we change everything. So it's the same thing.
Well, Ms. Jenna, I can't let you get out of here without asking you some fun stuff. Like, when you healthy and you feeling good, you know what I'm saying, your sickle cell is under control, what do you do for fun in France over there? What do you be doing?
Actually, I do. I work a lot, and I'm blessed with a big family. So, and I love cooking because my father was a cook. So usually I throw parties, and I make sure all of my friends and my family are around. And I travel a lot because I love traveling.
Okay.
Well, Kier, what we gonna do? We heading over to we gonna take the little plane across the pond and get us some good food.
Yeah.
We gonna come over there. You better be nice to us.
Yes,
she
of course.
Said she likes cooking. So
That's right.
what is your diet like? What you in there burning up on the stove, Miss Jenna?
Sorry, I didn't understand.
I said, what? Oh, that's why I'm American. I gave her an American.
What you be burning up over on that stove?
What am I cooking, right?
I'm talking to them. In my dialect, what you be burning over there on the stove? She said, I do not understand.
Qu'est-ce que c'est, mon frère? Qu'est-ce que c'est?
I'm sorry. Let me Americanize this question for you. What do you like to cook?
I like cooking Senegalese dishes because my parents both were from Senegal, and my father was a cook and my mom was also an amazing cook, even if it was not professional. So most of the time when we gather with my family, I'm the one cooking traditional Senegalese dishes.
Jollof rice?
Yes, yeah. Jollof rice. Very right.
Right, okay. I ain't never had
Je mange beaucoup.
Oh, très bien.
What are y'all doing?
hey man, look, this between me and her, Kier.
I see. No, I didn't even know what you said, but that. So you travel, you love cooking, you're doing wonderful, you're doing great. You know, please tell us about this before we let you go. Tell us about the work you do with SOS Globi. Just tell us about the work you do for the support you do for patients here in the U.S.
Okay, SOS Globi is actually a national organization that gathers 20 local organizations, because doing lobbying and everything is great, but it doesn't make any sense for SOS Globi anyway if they are not able to help out the patients when they are in hospital, when they are struggling to have access to a treatment, when they have a crisis, or when they don't have enough food to eat at the hospital or close. So you have teams in each cities that help out the patient when they need it. And then you have a team at the national level that would talk to politics, talk to doctors, and make sure that we have the good guidelines, to help out the patients at the national level in order to get eventually this national plan for France.
Nice. Well, man, Dr. Hebert, what can you say, man? What can you say, man?
She's all over it. All over. And like, we need more people like you in America, but I'm telling you, it's really important the work you do. When you go to that ER, demand that you get what you need, advocate for yourself, advocate for your partners and your family, because we're out here fighting on this side, and we're going to be over there helping you fight on that side too, sister. That's for sure.
Thank you very much.
Well, you know what? We're so proud of you. I know I'm personally proud of you. And thank you so much for coming on the show. We want you to keep up the good work. You're doing such a fantastic job. I can't wait to get some of this cooking you're doing. I'm sorry you didn't understand what I had said the first time because I have been American, but it is a pleasure to talk with you. You made this so much fun. You're worth it. Thank you so much. Ladies and gentlemen, Miss Dianaba. Miss Dianaba!
Thank you very much. My pleasure. Thank you.